which includes hand hygiene, barrier protection, and safe use of sharps, whether that's a needle or your instruments. The use of ultrasonic devices is contraindicated on a patient who has known HIV infection due to its implication of HIV transmission through aerosols. False. What did Dr. Cho say about how long HIV lasts, approximately? 7 years or less. Which of the following is a mode of entry for HIV exposure? Buoyancy, bloody mucosal splash, or percutaneous injuries. We're not going to get anything with intact skin. And, of course, hair, nails. I like that one. Which of the following body fluids is potentially infective? Yes. Amniotic is the one. Tears, no. Sweat, no. Nasal secretion, no. But amniotic fluid, yes. All of the following are high risks of transmission of HIV worldwide except. So blood products, yes. Sexual intercourse, yes. Perinatal, yes. Occupational exposure. I was trying to include that on your, twice in the assignment, and at least with dental especially, it's 0. Occupational exposure is minimal because the HIV virus does not live for very long. And so my nephew, he does surgeries in Africa. He's a general surgeon. And they have so many HIV patients. And he's had probably, I don't know how many exposures. But he has never contracted the disease. Partly, he's careful too, but it's just every day he treats patients, general surgery, with HIV. And it's because it's only one, you have to actually, it has to be blood-borne shortly afterwards. And then even then, it's only a how much? 0.3% chance of 0 conversion. So that's not even 1%. It's not even. So it's definitely helpful. How much is hepatitis approximately B? Okay, yeah, 22 to 30 approximately. And so much more concern, but why is it not a concern for us at this point? You're all vaccinated, or you wouldn't be in school. You either are vaccinated, or you have to prove like I did, since I was vaccinated so long ago before I could work here. I had to have a blood draw taken to show that I had the antibodies from the vaccination. So one of the two. So that's very helpful for us, but we're still going to talk about Hep B because it is highly contagious for your patients if you're not careful, because that virus lives a long time. So that's what makes it interesting. Okay, this one was online. You have just accidentally stuck yourself in the hand with a needle used to administer local anesthetic to a patient who is infected with HIV. Which of the following should you do next? Very first thing you should do, wash your hands heavily, and with soap and water, over and over there. And if you have a mucosal splash in your eye, there's an eye wash station in every clinic. We have one in the hygiene clinic, and you go over there and you spray in your eye. It has a flush that actually flushes up into your eye. And so very, very important. That's the first thing you should do. You're going to minimize your risks dramatically. What types of hepatitis are not an occupational concern for the dental hygienist? A and E. After reading your textbook regarding the case of patient-to-patient transmission, what did it imply the cause of? I hope you could maybe guess if you didn't read it. It was only 3.5 pages this week. infected dental equipment or bloody, a matter of not wiping things down well enough or infected equipment, yes.
If we put not using standard precautions, that would not okay.
I'll look back to what the book says exactly. That's kind of, that would be kind of included. I'll think about that.
It's not incorrect.
No, it's not incorrect. And it could be, yeah. Okay, I'll think about that. Okay. And if like 20 out of you said that, I might, I'll look at it. And AIDS diagnosis is made when the patient develops life-threatening malignancies. What is one of those malignancies? Do you remember? That's specifically AIDS-related, and it's often in the oral cavity. That's Kaposi sarcoma. It's that black in the. But you didn't have to answer that. Okay, I'm just saying it. Okay, sorry to scare you. Life-threatening malignancy and opportunistic what? Infections. CD4 lymphocyte levels that are less than how much? 200 and a viral load of 3,000 copies. It's really important you know that 200 number, less than 200, because that's always along with the opportunistic infections, which are often oral. What's the number one opportunistic? Can't even spit that out. Opportunistic infections. Thrush, or what's the other word for that? Oral candiditis. What else?
Hairy leukoplakia.
Hairy leukoplakia. What else? Angular colitis, I think it is.
Oh.
I'm not sure. Yeah, you're still, I think it's colitis. Right here. Herpes.
Gingivitis.
Oral warts. Yeah, nut and nug. Do you know what that is yet? Have you talked about nut and nug in any of your classes?
Ulcerated gingivitis.
Necrotizing ulcerative gingivitis or periodontitis. It's extreme. You've never seen anything like it. When you see it, you're like, I feel so sorry for this patient because it looks so painful, the gingival tissue. I'm sure you'll see pictures this quarter. Okay. There any questions? Okay.
I have a question.
Yes, ma'am.
How many patients have you encountered over your 10 years?
No known ones. I'm sure I have encountered them. I'll tell you what, when I'm reading through this, you're not going to believe this. It's going to tell you how my age, but that's okay because I don't care. When I got out of dental hygiene, it was 1 year after they first had heard of HIV in Africa. 1 year after I got out of dental hygiene was when it became public knowledge. We did not wear gloves in dental hygiene or when I was practicing in private practice at the beginning. I finally started buying my own as soon as HIV/AIDS came out, and finally my dentist started buying them for me. But then he made me wash them in between, and we had to use powder to try to make them last. Terrible. So just appreciate your gloves and the fact that you get to just do this and grab another pair.
What year was this?
1800. I'm looking pretty good. 1982. That's when I graduated. Yeah, isn't that crazy? No gloves. Think about it. Sticking your hands in with no gloves. Didn't really bother me. That's what you did, and unless you had an open wound, then it was a big deal. But, you know, that's how it was. The worry was not there at that point. So, very, very frightening to think back on. Just kind of can't believe it. Okay, we're going to do a couple poll everywhere questions, and then we are going to move through this. Okay. Now you get to see how it's done there. Okay, are you open? Is it taking a while? Oh, yeah.
Let's make us log in. Yeah.
Can you rephrase this, the
The question is not complete.
Oh. Oh, weird. Have a vaccine available.
Oh, it says it's not showing up.
It is on some of yours and not on some of yours?
It says as soon as you display it, it'll show up on here, but it's not showing.
That's weird. What did those of you who got on do differently?
I just signed in.
I just had to re-sign in, and then once I signed in, it helped it.
I've got 18 responses. Who's having problems still? Okay, we'll see if we can do it on the second one. Okay.
Well, I don't know how to
Okay, anybody still having problems or is it working? Okay, well, we'll go ahead. Okay, so fortunately, we have a vaccine for A and B, but not C yet. They're working on it, so it's hopeful. The vaccination for B covers D, so you will never get B or D. How many of you had to get a hepatitis A vaccine to ever go on a mission trip or out of the country? Yeah, I did. Okay, you may have to go if you go to some of the countries. Okay. Which of the following is not passed on through the blood? Oh yeah, thank you. Few more? Hepatitis A, out of all those, are the only ones. So after we talk today, that will be really important. I have a chart that I hope will help you guys break this down, trying to make it as easy as possible for you. Okay. I just want to touch on this because all of you are seeing patients now upstairs. So I know Miss Lee posted this for you, but repetition will help. And I would encourage you to copy and paste this into a page that you put in your clinic binder, because this will really help you. And then you won't have an instructor come over to check your health history and say, it's been 3 years, you didn't update it, or you going through the effort of doing the whole chart and it's not necessary yet. So this is how we should do it. Health history should be completely updated every 2 years. Look down through all the dates. There should be nothing older than April of 2017 as a date, okay? So sometimes we update stuff in between, but we don't update it all because it's not time yet. So just think 2017, if it says 2017, look at that date. Then we need to make sure it's completely updated from top to bottom. It is best to ask them all the questions. You can ask them quickly, and if there's no's, there may still be no's, but if they've changed, it's important. If it's the same answer, this is confusing because if it's a no and it's still a no, you can't click on no and have it update the date. So you have to do Control R. And then you can just go down it really fast as you're going down. Just Control R will update the date. Same with your blood pressure and pulse. If it's exactly the same as it was before, just do Control R and it will update your date. Okay? And then you may or may not know this yet. You put your vitals in the vitals tab, and then you go to your health history tab and you double click in blood pressure or pulse. It only allows you to transfer those two, not your respiration. Okay? So, and of course, that it's nice because that nice little pink box at the bottom says make sure you have your patient sign. We can approve before or after the signature, but if you have them signed before we come, and we come in and type one word or one letter or anything, you're going to have to make your patient sign again. So I recommend we just have them sign as soon as the instructor's checked, okay? Because then then that way you don't have to make them sign twice. On recall appointments, so if you see them again in 3 months, 4 months, 6 months, you're going to click that very top question and say, yes, this is an update. So again, if it already said yes last time, do Control R, because it's going to be an update. And then you're going to go through it, and it's really important to ask that first question at the beginning. Have you seen your doctor in the last year? Update that one if it's changed. And but I'll go through that on the next slide. So you click that it's an update, and then you make any changes verbally. Say, like you saw a patient and you saw him a first time and you're going to see him next week or the next week, and you're going to see him a second time within a couple weeks. You do not click this is an update. You do not have to do it on repeat visits, just on recalls, okay? Because that's so recent. You're still going to say, has anything changed since 2 weeks ago? And have you been, sometimes, most likely we don't need to say, have you been hospitalized, or they probably wouldn't be there. But you definitely want to ask them if there's been any changes, but most likely there hasn't been in a couple weeks. So you don't have to sign that. Okay. But what you do, and it's in Miss Lee's template, is that in your treatment note you said health history updated or reviewed. Okay, so even though you don't click on updated. And then here's your questions again. You can say, have you had any changes? It probably would be, have you had any new medical conditions? Then they'd go, oh yeah, let me think. Have you seen your physician in the last year? And then the same questions that I've had you memorize before. And if they do say yes, you want to know why and when. If they've seen their doctor. When did they see him and for what? And then the have you been hospitalized, ER, I finally wrote it right and said the ED. For patients, they're not going to know what the ED is just because in healthcare, that's what they call it now. And every 3 months, 4 months, absolutely have to ask about their medications. Look at their medications and say, are you still taking this? Read it back to them. And if they are still taking it, then leave it. They may say, oh, here's a list, and they want you to compare. That's fine. If they say, no, I'm no longer taking that, delete it. Clear it out, okay? Because it's too much to look at every time and try to figure out and read through that whole thing to see, oh, patient discontinued at the very bottom of the soap or something. So delete it. You are not deleting the record that they did take it because all those health histories of previous times are saved in the system, okay? So be sure and clean it up so we can, especially when there's 20 medications, okay? And then add any new ones. That's really important. It's not just medication supplements, okay? So those are the biggies for updates. And then the other thing is anything that had a yes, did I not put that on there? Anything that has a yes, you're just going to verify. How are you doing with this? I mean, if they say they had cancer 25 years ago, it's most likely not going to be any problem. If they say they had cancer 3 years ago, then I'm going to say, have you seen your oncologist? How's that going? How are you doing? Anything that's a yes. Does that help you kind of know how to direct your questioning process? Okay. Okay, we are going to go through this relatively quickly, except for I really want you to see this. If we understand that, it's going to be more helpful.
Writing's not that easy, but Grammarly can help. This sentence is grammatically correct, but it's wordy and hard to read.
There's a factory inside you that weighs about 1.4 kilograms and runs for 24 hours a day. This is your liver, the heaviest organ in your body, and one of the most crucial. This industrious structure simultaneously acts as a storehouse, a manufacturing hub, and a processing plant. And each of these functions involves so many important subtasks that without the liver, our bodies would simply stop working. One of the liver's main functions is to filter the body's blood, which it receives in regular shipments from two sources. The hepatic artery delivers blood from the heart, while the hepatic portal vein brings it from the intestine. This double delivery fills the liver with nutrients that it then sorts, processes, and stores with the help of thousands of tiny internal processing plants known as lobules. Both blood flows also deliver the oxygen that the liver needs to function. The blood that is received from the intestine contains carbohydrates, fats, and vitamins and other nutrients dissolved in it from the food you've consumed. These must be processed in different ways. In the case of carbohydrates, the liver breaks them down and converts them into sugars for the body to use as energy when the filtered blood is sent back out. Sometimes the body has leftovers of nutrients that it doesn't immediately require. When that happens, the liver holds some back and stacks them in its storage facility. This facility works like a pantry for future cases when the body might be in need of nutrients. But the blood flowing into the liver isn't always full of good things. It also contains toxins and byproducts that the body can't use, and the liver monitors these strictly. When it spots a useless or toxic substance, it either converts it into a product that can't hurt the body, or isolates it and whisks it away, channeling it through the kidneys and intestine to be excreted. Of course, we wouldn't consider the liver a factory if it didn't also manufacture things. This organ makes everything from various blood plasma proteins that transport fatty acids and help form blood clots, to the cholesterol that helps the body create hormones. It also makes vitamin D and substances that help digestion. But one of its most vital products is bile. Like an eco-friendly treatment plant, the liver uses cells called hepatocytes to convert toxic waste products into this bitter greenish liquid. As it's produced, bile is funneled into a small container below the liver called the gallbladder before being trickled into the intestine to help break down fats, destroy microbes, and neutralize extra stomach acid. Bile also helps carry other toxins and byproducts from the liver out of the body. So as you can see, the liver is an extremely efficient industrial site, performing multiple tasks that support each other. But such a complex system needs to be kept running smoothly by keeping it healthy and not overloading it with more toxins than it can handle. This is one factory we simply can't afford to shut down.
How do you like that animation? Anybody watch the Magic School Bus back in the day? Love that. Okay, so it just gives you an idea of what's not going to function if there's liver problems. And so we'll kind of go from there. So we're going to talk about modifications and post-exposure prophylaxis for blood-borne type of puncture wounds. So we definitely don't want to acquire the disease if we're treating one. We definitely don't want to spread it. And often patients with poor oral health or have poor oral health if they have hepatitis. And there's definitely a few risks to down treatment as well. I'm going to put this summary of hepatitis at the beginning and at the end and in your assignment, if that gives you a little idea. So 3 times, hopefully will help you get it. It seems like a lot of numbers, but if you can know which ones don't have a vaccine, and I'll explain why these numbers are important, but you need to know those numbers associated with hepatitis B. You can either learn them this way or this way, and then you've already learned this last time. But there's a reason for understanding those numbers, so hopefully that helps you. Remember 0, 0 here, so that you just put that out of your head because there's going to be no chronic infection. So it's just B and C, well, similar to Hep B, but so just throw that into B. And then the number you learned from last time. And I'll try to break that down. So we've got 5 viral hepatitis. Those are the main ones, A, B, C, D, E. There's non-A, non-E, but we're not going to go into that. The only 3 hepatitises that cause liver cancer are the 3 in the middle, and it's because they're bloodborne and because they can cause chronic infection. A and E, remember those 0%, we'll talk about a little more, but there's no chronic infection after you've had it. It's like having the flu, you're really sick, the virus goes away, and it's gone. It's not still in the liver. So hepatitis basically means inflammation of the liver. The signs and symptoms are similar for all the different kinds. It's basically intense flu symptoms. So kind of matches right up there with HIV. So it's pretty hard to diagnose all these different infectious diseases from a really bad flu virus, HIV, to hepatitis. So hepatitis A, my niece used to give this lecture because she's internal medicine, but now she works at had worked at the VA, but she's doing the internal medicine rotation for the 3rd year medical students. So she's not available anymore. So this is kind of I've adapted the slides from her original presentation. But she used to always say this. So there's A, B, C, D, E. So A and E are given to you by the oral fecal route. Okay, the beginning and the end. Okay, so A and E, to help you remember, you get it through either orally, like saliva, or fecus. So it's usually something that we might get in a 3rd world country or in really poor sanitation areas here in the United States. It is not bloodborne. So A and E, oral fecal, bloodborne are B, C, and D. Okay? A lot of the world population has had hepatitis A. almost half of the whole world. Not as many in the U.S. You can see it's a pretty low number for the U.S. out of all of that. That just gives you an idea where there's high prevalence, especially Africa, Mexico. So again, it's mostly transmitted by feces, so unsanitary areas. Or possibly in the U.S., it could be from a place where a child care center where kids aren't being made to wash their hands or going to the bathroom. That type of thing could cause transmission. Otherwise, serum, really it's mostly that. So they're just to review contaminated food or water. Not too likely here, but it could even raw shellfish and undercooked foods. So it could happen. So it's pretty quick. You get sick in about 2 weeks, or could be a little longer. Children who get it are asymptomatic, which means they usually don't get symptoms. So you don't even know they've had it. But adults over 18 are more likely to be symptomatic, and they can get jaundice. It's everybody, that's a yellowing color. So that can happen with any of the hepatitis. Acute illness, it's only 1 to 3 weeks, just like a really bad flu could be. So most cases resolve. There is a low percentage of death during the acute infection. So I just want to review again, acute is active infection that's happening right now, and then chronic infection is something that stays around for a long time. So we'll talk about that, but it's important for you to know the difference with hepatitis, as we're not going to treat anybody who's in acute infection. Most likely they wouldn't be seeing you because they're going to feel so terrible, but we're going to treat everyone who has a history of hepatitis with chronic infection unless they have some other problem. Okay? So hand washing is really important. So chronic hepatitis A infection does not exist. Once you have it, it goes away in 1 to 2 months. So it's not really our big concern. Unless you maybe are going to another country, like I said, they don't even recommend that healthcare workers get hepatitis A. So that's why most of you, vaccine, that's why most of you have not had it. When we went to Costa Rica, it's only a second world country, I don't know why, but they recommended, so my whole family got it 20 years ago or whatever it was. So hepatitis A vaccine does exist. Yeah, there you go. That's just what I stated. So again, that's just a summary. So hepatitis B, mode of transmission, is blood or bodily fluids. And unlike, what kind of virus is HIV? Do you remember? A retrovirus? RNA? Okay, so Hep B is DNA. It's different. So at least 2 billion people across the world have had Hep B, and 1.25 million deaths per year worldwide. That's a lot of deaths. So this is a serious infectious disease, and quite a few carriers. So it's the most common cause of cirrhosis and liver cancer, and actually liver cancer's 5th most common. You don't hear about it as much, but it's probably because of the population you're with. There again, you see similar areas have higher incidence. Thought it was interesting that Alaska has a higher incidence. I'm not sure why that is. So again, blood and serum are high incidence. Saliva is moderate. And of course, saliva with blood is up there then with the blood products. This just gives you an idea. I like this in that hemodialysis and a blood transfusion is now 0, because if anybody donates blood, they really check for anything such as hepatitis and anything. So you're very restricted on giving blood. You can see that injection drug use, it's not as high with this one, 14%. That's one of the ones, otherwise it's kind of spread out. So multiple sex partners, unknown is pretty high, 32%. So again, just for our risk or what used to be a risk, there is the vaccination. There's approximately a 95% seroconversion rate. So there is a very small percentage who don't actually form antibodies to it. And so if you were actually had a severe puncture wound with a hepatitis B patient, they would still recommend that you go in and have a blood titer taken and analyze your antibody towards the HIV virus to confirm that your levels are high enough to resist it. So just something to think about. We don't want a puncture wound from any patient, but occasionally it happens. And so I really encourage you, if you have a patient with a health history that rises a little red flag to you, to slow down a little bit when you're injecting, when you're cleaning your instruments, when you're just moving in the cubicle. Sometimes you're moving quickly because you're in a hurry for that next patient and your instruments are right there, and say the Explorer's sticking way out or the probe with blood on it. Easily can happen and you get a puncture wound. That's why we Miss Lennon and all of us give you, we're so careful about recapping your needle to just avoid puncture wounds. Very important. But sterilization, it can happen too. It's happened to me. Explorer sticking out, I'm grabbing it and quick, it just came through the side. It can happen. It's way better if it's gone through the ultrasonic, but it's especially with hepatitis B, it lives much longer. Blood spatter. So again, if you're wearing PPEs that wrap around your eyes, that's why we don't really like anything that's too open on the sides or underneath. You don't want any way for that to splash in your eyes. And that's why we wear a mask, keeps it out of our nose, mouth. So hopefully blood spatter is not a problem, but think of it, with the Cavitron, the ultrasonic, you are causing aerosols that filter down and land on things. So certainly you want to be extremely careful with your after wipe down for your next patient. They may be an elderly lady, just like in the book, who has no risk factors, maybe is immune compromised and needs and gets it just from it remaining on some kind of instrument or surface. And also you want to think about it if you have kids or anybody you love when you go home, and it's, it could be on your hair, even because everything comes up to here. Any clothes you wear, take them off, get rid of them as soon as you get home. Get out of those scrubs, get out of those shoes, and before you do any hugging of your kids. I used to come home and say, just a minute, and I'd hug everybody, but it's still it could be everywhere. So it's something to think about. Okay, it takes a little longer for incubation, but usually between 2 and 3 months. Again, children can be asymptomatic. A lot develop jaundice in dark urine, kind of goes together, so a real dark yellow urine. The good news is 90% recover completely. So hepatitis B, when you're treating, this is why I want you to know these numbers. When you're treating a hepatitis B patient, they only have about 10%, or there's about 10% who actually develop a chronic infection. So they're still infectious, is if they have a chronic infection. So that's encouraging. That number is encouraging. But then, the next number is that 22 to 30%, you're likely, if you if somebody didn't seroconvert or another patient, you could easily get hepatitis B. It's very contagious. Okay, so hepatitis B was the first example that cancer could be prevented with a vaccine, because if you don't get hepatitis B, you won't get cirrhosis of the liver, cancer of the liver. So it was actually extremely exciting when that first came out. There's 2 kinds of immunity. I'll try to make this really simple. Or there's actually 4 kinds, but I'm only going to help make you learn the 2 kinds. It's in some of the board books, but it makes sense. Acquired active immunity. So acquired means you have to get it somehow. So that's the vaccine. Somebody has to give you the vaccine. Active means your body has to do something with it. So it takes those little antigens that you get in the vaccine and makes your body create antibodies. So that's acquired active. And then, let's see. I'm going to go ahead and just jump forward a little bit. Acquired passive is when you get a sharp injury and they give you the immune globulins to fight the antigens after the fact. So then you're just giving them. You're still giving them by some type of port, probably an IV, but your body doesn't have to create anything. It just uses them to fight the infection. So hopefully that will help you remember. If for some reason you got a sharp injury and they did a blood titer on you, and for some reason you didn't seroconvert, that means you go from antigens to forming the antibodies that fight it, then you would get the hepatitis B vaccine and the immunoglobulins afterwards, post-exposure protocol. You would get those. Most likely, that's none of you. Okay? I'm going to, since we're going to do that team activity, I'm going to break then. And so I'm going to go just a little farther so we can cruise through this really fast. Again, just a reminder, HIV risk is 0.3% versus hepatitis B at the high percent where it's, say, 30%. Just a reminder. I did want to go back here. Okay. There we go. Yeah, we've talked about that. Okay. Hep C. The reason your textbook says what is, I don't know, Sabine, can you read it? Is it right there, your quiz question? What did it say? Here, I want to say it right so that I think it's page 110. I'll read it to you. Oh, this is a good one. Okay, which of the following forms of hepatitis pose the greatest risk for occupational exposure? It only put C, A, E, and D. It didn't put B down. Maybe to not confuse you, because B would be the highest risk initially if we weren't all vaccinated. So the answer was hepatitis C. And seriously, in my opinion, there's 2 things I worry about the most working as a dental hygienist is hep C and tuberculosis. That's probably the most concerning of anything we work with. So hep C though, however, there's good news about it. And I'll show you the numbers on that. So this is an RNA virus. I'm not going to make you remember all the DNA, RNA, different ones, but it is interesting that hep B is a DNA versus the RNA of HIV and HCV. But the majority of these are drug IV users. And there again you see the higher populations actually with the way those numbers are towards the bottom. And again, illegal drug use, 60%. So that's a high amount. The other ones, sexual transfusions, probably not much anymore. This is a very old one. They don't update these very often. So the good news here is that you only have a 2% risk of infection with hep C puncture wound stick. So it's way lower than hep B if you weren't but it's still 2 out of 100. And so it's definitely conserving, much less if it's just blood spatter. Again, a lot of them are, a lot of people are asymptomatic with Hep C at the beginning. And then the problem is there's 85% of them develop chronic infection. So most of the patients you see are going to be chronically infected with hepatitis C. So just consider hepatitis C patient as being infectious to you. You don't know that for sure. You could ask them if they've been tested. Actually, that would be good. But only 15% recover completely. So the percentage of patients who actually have chronic are much higher than Hep B. Hep B is only 10%. These are 85%. But your chance of actually getting an infection after a needle stick, again, discounting the vaccination for B, is only 2%. I mean, 2%, not only, it's still important. So, yeah, HIV co-infection, very likely. Male gender, heavy alcohol use, age of 40 and over. It's a big one in the baby boomers. So the people that were born between 1945 and 1965, partly because of all the vets from the Vietnam War. So hepatitis C, no vaccine available. However, they're really working on it. So it's looking much more encouraging. Again, best prevention is slow down with a Hep C patient. Be careful. Don't get a stick wound. If you do, then now at least you can go have immune globulin from Hep C. Didn't used to be that was a possibility. So at least it would lessen your chance. And the really good news is in the last 3 years, there's new medications that have come out that actually are starting to, if you take them, stay on them, they're eradicating hepatitis C, actually curing it. That's brand new. The problem is it's extremely expensive, so not anybody can just have $100,000, $200,000 medication treatment. So it is available, and they've seen, it's just like the HIV, that they're finding there is something now that might work, or that does work with HCV. They're still testing that. So, okay, let's just get through this. HPC cure rate greater than 90%. Huge outcomes that we didn't have 3 years ago. Okay, hepatitis D, only those who are also infected with hepatitis B can get it. So, mostly in IV drug users and hemophiliacs. But if you have Hep B, it covers you. Hep E is fecal contaminated water and food, but there is no vaccine for Hep E. And there you see where it's mostly Mexico, Africa, and Southeast Asia. Okay, the big things about hepatitis is that they've only briefly talked about, and we're going to talk about it a little bit next week, but hepatitis, the liver makes your clotting factors for blood. So when the liver doesn't work, your blood's not going to clot properly, and that's why you're more likely to bleed more. So there's a risk of bleeding on those patients. They can have little, I'll show you pictures next week, but little petechia, if you haven't heard of that yet, in oral path or somewhere else. It's little pin spots of bruising, kind of. They're usually brighter red, though, instead of purple. But they can be in the palate, little petechia, little dots. They're flat, but that's bleeding. So actually, platelet counts and INR in these kind of patients would be appropriate, but that would be through the doctor. One thing to really know, so Advil is processed or metabolized, or ibuprofen, any of the NSAIDs are metabolized through the kidneys. Tylenol is metabolized through the liver. So if you ever hear of a toxic dose of Tylenol or acetaminophen, it's the liver. So actually, on a patient like this, you'd actually want to give them NSAIDs. I know that, and really not even NSAIDs, because that's going to increase the bleeding. So you've got a little bit of a problem with a patient like this, but Tylenol's not going to be your standard go-to because they're metabolized different. In fact, the new opioid that dentists are using is a mix of acetaminophen and ibuprofen. And if you ever have a lot of pain from something, and you wish you had a Norco to take away the pain, and you don't because they don't hand out opioids, literally Tylenol mixed with Advil is very effective, and now they're recommending to the dentists to offer that to their patients instead of Norco. And it's 500 milligram Tylenol with 3 Advil. It's very effective. So just FYI for any of you, or if somebody knows, but remember, you can only take, it's toxic after 4,000 milligrams of Tylenol in one day. Dr. H probably talks about that too, but it is very effective. It's good to know. Okay. Here are the questions we should ask patients. What type of hepatitis do you have? If they don't know, then you could say, how did you acquire it? That would probably give you an idea. What type of treatment did you receive? Have you ever been tested to determine if you're a carrier? That's an okay thing to ask. And do you have liver damage or bleeding? You didn't have the questions for HIV last week, but I just added those. When was your last complete blood count? And do you have the results with you? What medications are you taking? What are your side effects? And do you bleed a long time? Okay. I think I'm going to wait on that, and I don't want you to take home any extra work to do. So this is really important. Postpone elective dental treatment if they're active. Again, I'm not sure that they would be in your office if they were, but active or acute, that's the same word. You're going to get a quiz question on this, I promise you. So, if a patient comes in only with a history of hepatitis and they have a chronic infection of it, we can treat. We're going to treat. Otherwise, they'd never get treatment. So, we're still going to treat. We're going to use our standard protocol, and we're going to protect ourselves, and we're going to protect our next patients. So, that's just something to remember. Okay, this we already talked about. This I'm going to have you put in your assignment, but it's really important. This is just the protocol: local wash with soap and water, flush eyes. This is with HIV as well, if depending where it went. Assessment for risk. Actually, if you look at the notes below, you're going to assess the patient. You're going to assess the mode of entry. If it's they call it a large. What's the word? Anyway, if the large bore needle, which we don't use in dental hygiene, but the really larger openings in a needle is going to grab more blood. So if you get that, you're going to get more blood in your finger, wherever you stick yourself. If it's smaller, they say a 30 gauge needle, which we use for palatal sometimes, it can't transfer. It's so tiny. So that's something, if it's superficial, it's not nearly as worrisome. All those things. If you have gloves on, it decreases the amount that goes through by 50%. We all wear gloves. So all that is important to know. But you're going to get risk counseling. If you don't know if your patient has HIV, you would know most likely if your patient has HBV, but you may not, I guess. That's a possibility if they lied to you. You're going to really check your patient's health history. Okay, chronic liver failure, we certainly don't want to dismiss that. That's often caused by hepatitis or heavy drinking, whatever it may be, cirrhosis of the liver, hardening of the liver. Terrible, this is a gross picture, but My niece sees patients like this at the Veterans Hospital. It's called ascites, and it's fluid buildup. They can take that out, and it will rebuild up. She says death by cirrhosis of the liver or liver cancer, whatever, is the worst possible as far as patient comfort, just because of those types of problems. Again, risk of bleeding because the liver forms those anticoagulant proteins. They actually, she said, they do have increased pain, so lower pain thresholds. They actually are more reactive. It's been proven to be true. So what would we do with increased pain as far as our anesthesia? Are we going to give them plain anesthesia, or are we going to give them anesthesia with epinephrine? Actually, with epinephrine, it's going to give them more profound anesthesia. Okay, and there's no contraindication really. I mean, you'd probably not use 5 cartridges in one time. They're going to have increased risk of infection, almost everybody we talk about, and avoid certain drugs. Okay, that's it. That's a lot. So mostly review the summary slides and really know the green box. Again, only what's in red. You should be able to eliminate everything else. You will have questions on that. No Hep C, no Hep B. Hep C is really a big deal because it really affects us, but Hep C is a really big deal because it could affect your patients, okay, and those you love who haven't been vaccinated. So it's very important. Okay, so what I've given you is under modules, I've given you 3 pages of a health history that I've screenshotted. And then I want you to get together with your teams, and I just want you to come up with the questions that the health history would elicit. Some of them just have a yes without any information about them. Some of them have some information that may give you enough information or you need a little more. So just brainstorm. This first one I'm going to grade relatively loosely. But that doesn't mean, you need to look like you've put some effort into it. This is one way I can put some of the percentages not on your quizzes and exams, okay? So I'm trying to do something to help you learn without just being quiz questions. And so also you'll just follow that, I'm going to do the standard. Can they have nitrous? Can they have vaso? Do they need pre-med? Do they may need a med consult? So come up with what you think they'll need as a group. And hopefully I did it right. I tried to do a group submission now. So there's teams 1 through 6. And if you can get together with that team and try to pound it out in the next 20 minutes so that you don't have to take it home and it's over with. I don't want you to have anything more to do, but I think this will help you in your learning process. We'll do this 3 times, and then there'll be mini ones in your sectionals and one big case, just one case, a full case in your final. So it's just will help you get used to it. So can you access it okay? It's under modules, and it's called HIV Case Study 1.
Yeah, and then there's 3 under it.
Yeah, there's 3 pictures. I had to screenshot the health history in 3 different ones. Okay. So just fill out the student response form or the health history form there. And so move around, get with your team, and I can help you. I'm here to help you answer questions. But you want to
Is it the groups
get...
that we did the video with?
Yes, yes.
Yes. Let's go start with it. So we're going to start with
Trying to remember.
I thought you were ditching. I was like, seriously, what?
How are we answering this? We're using this.
you're looking at the health history. Start with page 1.
Sorry. Oh.
Yeah, that was page 1. Sorry. And then you're going through the yeses or anything that you think you need to ask more questions. Like here, you know that it goes to this doctor, but you don't know when or why.
Okay. And then what does this have to do with what